Greetings, Dr. Mark Winton here from the Department of Criminal Justice at the University of Central Florida, located in beautiful Orlando, Florida. And today I'd like to talk about AI and mental health, the mental health field. Have you ever had to talk about something, or you gave a presentation and you just weren't sure what you were doing? Well, this is a case right here. I'm still trying to wrap my head around AI, to understand it, to look at the benefits, to look at the risks and problems, to look at how we can use it appropriately and ethically, how it can be a learning tool, how we can prevent the misuse. And based on all the courses that I teach, it comes up in every course in some way. I mean, for example, in my terrorism grad course, we're looking at how AI is used by terrorist groups. And in the profiling course, we're looking at, well, how, one of the questions I ask in an extra credit assignment, how would you use, AI, for example? And the same could be in my serial murder course, and certainly my mental illness and crime course. I mean, it's everywhere. I remember last year when ChatGPT came out, and my wife sent me the link, and I thought, wow, uh-oh. And one of the things I did is I had it write about my own research, and I was shocked because it got some stuff wrong, and it made up articles that I had never published or that didn't exist. And so one of the first things we recognize with a lot of these AI platforms is, and the professionals say, they hallucinate. They just make stuff up sometimes. So we have to be very cautious because, there's a lot of risks if you have very faulty information and you apply that. So, I mean, we still have to consider that AI really, it's not an answer for everything. And there's inherent risks if we don't use it appropriately. I'm not going to try to go into how to use it appropriately. I'm just saying that sometimes it makes stuff up. It's like your old friend from years ago who would go on those adventures, and you're thinking, AI. Anyway, I wanted to go ahead and look at some different features and ask some questions. So I posed a couple questions, and I wanted to just talk about that briefly to the Pilot AI platform. And the question I ask, and I'm going to tell you some of the responses I got from it, and then we'll see, how all this makes sense. How can I use AI in the mental health field? So I start with a very general question. I mean, when you're using AI in research and things of that nature, you're going to start specifying it more and more. And they'll ask you, go more and more detail, more and more detail. Okay, so they have 8, and I just want to kind of mention those. These were created by the Pilot platform that you all have access through the university free of charge. So if you haven't, you can explore it. It's certainly interesting to look at. But let's take a look at that. Some of the possibilities or impacts that AI is or may have or will have in the mental health field. Number 1, AI-powered chatbots and virtual assistants. So there we're getting at the whole idea that we have these chatbots or virtual assistants that are available anywhere and any time, as long as we have the correct device to connect to them and know how to connect to them. And so you get these AI chatbots that might be programmed to provide certain interventions or present some ideas about coping with mental health situations, and even offering some type of emotional support. So that's what the Pilot platform generated for the first item: chatbots and virtual assistants. And I always think about, have I ever experienced some of this? And certainly we've talked to chatbots or interacted with chatbots before when doing certain things, right? Always interesting, you get frustrated, you're talking to a chatbot, you're like, get me the customer service. And hello, I don't understand that. So it's an interesting thing. They also know how to frustrate you until you give up. You say, you know what? I'm not going to even talk to them. Okay, so it has to, really be set up in a way that is helpful, that's based on research. And so it has to be the right intervention, the right support. Number two, early detection and diagnosis. So here we have AI analyzing the language that people use. And we're talking about either speech or text, but I'd also say you could even go with photographs and things of that nature, videos. And what AI does in this situation of early detection and diagnosis is try to look for patterns that are related to specific mental disorders that you would find, the symptoms that is, in the Diagnostic and Statistical Manual of Mental Disorders. For example, it would help in detecting, let's say, depression or an anxiety disorder, post-traumatic stress disorder, for example. And of course, these are aids that go along with a real person who understands all this and can monitor it and use it in a positive way, in a helpful way. 3, personalized treatment plans. One of the things that those who work in the mental health field, those that work in criminal justice system, you always have to create plans, treatment plans, and usually have specific items on there that you're striving to have accomplished. And that can help, in the case of the mental health professionals, creating those treatment plans. And insurance companies always want treatment plans when insurance companies paying for someone's treatment. What are the treatment plans in that sense? What plan to do? And so you're eventually going to see that financing and all that's going to come in. I'm not going to get into that area. And number 4 is predictive analytics, in terms of the AI platforms predicting mental health outcomes based on historical data. And so that's what Pilot Platform's talking about, using that. And I certainly have seen that, trying to understand who's at risk for relapse, for example, or at risk for certain crisis. And what we've been using, of course, clinical interviews, risk assessment tools. Some are more static, some are more dynamic, some are combination. And I kind of see in the risk assessment tools that I've been using over the years that those could easily be transformed and integrated into AI platforms that help for a more rapid response, perhaps, and a more specific one, taking into consideration multiple factors. So predictive analytics. Number 5 is digital phenotyping. And this is where AI takes a close look at someone's data on their smartphone or social media, or even things that they wear, monitoring, for example. I remember years ago that I was in a study that was being done at UCF that was related to health and diet and all that, and we had this monitor around our this device that we put around our arm, and wore it all the time, I think, except when we showered, and wear it when we sleep. It's kind of uncomfortable too, you couldn't sleep on that side easily, and wear it when you did any exercising or when you were sitting around watching TV. And the interesting thing, I went and you'd meet weekly with one of their researchers. I remember I'd go and the researcher's like, wow, your heart rate went crazy here for about 15 minutes. What's going on? And I'm thinking, that was Saturday at 1 o'clock. I was mowing the grass. Mowing the grass was the most vigorous workout. And I was going to the gym and lifting weights, and I was running, but nothing came close to the difficulty of mowing the grass. That was like the ultimate workout. So I thought, I can't mow the grass anymore. That's stressing me out too much. But the whole idea is, everything's monitored: our sleep, blood pressure, heart rate, respiration. If you think about having the lie detection type test on someone all the time, or being monitored for all kinds of different things, as the monitoring gets more sophisticated, you're starting to talk about more things going on inside the brain, talking about all kinds of high-tech things that will be used to not only diagnose and assess, but to monitor. And, that's, kind of a thing. Maybe some of you have these on your phones for sleep, for relaxation, for exercise enhancement, things of that nature. Number 6 is teletherapy and remote monitoring. And of course, teletherapy became very popular during COVID, when people couldn't go into, or wouldn't want to go into, for example, a clinician's office for a face-to-face meeting. And so telehealth really, saw that. I remember the first time I did telehealth was for sinus infection. And, it was just kind of interesting. Obviously, they couldn't look inside my nose or ears or things of that nature. But, when we talk about monitoring, just think, you have a little camera and, okay. Anyway, also automating administrative tasks. So that as well. Number 7 is research and data analysis. So processing very large data sets and presenting the outcomes of those data, or the findings, for example. But we still have to interpret. But AI might help us interpret. We might get in debates with AI. And then finally, number 8 is we really need to consider the ethical issues there. I mean, for example, privacy and confidentiality, extremely important in the mental health field. But how are we going, how do I know that if I'm talking to a chatbot about my mental health problems, where's that data being stored? Who's accountable for all that? And so we have so many questions. It's amazing. And transparency, to know what's going on. And informed consent. And I mean, the list goes on and on and on. So to summarize, and I only have this on one page, I was going on from my own thoughts, for better or for worse, that AI is a complementary tool. It is not a replacement for human therapists, but it can help increase the effectiveness, the accessibility, and maybe even, they say, precision in mental health care. So that's what I just wanted to briefly mention on the use of AI in the mental health field. And probably in a couple of weeks, a lot of stuff will be dated, or will start to be. After, if you're watching this now, and then you come back a year later and you watch this, so what's that guy talking about? That's old stuff. So I want you to start thinking about the future as well related to AI. Thank you.